What causes the fiery sensation in gout? Imagine a sudden, intense burning feeling in your joint that makes it almost impossible to ignore. That fiery sensation during a gout flare-up is actually caused by a complex immune response. When uric acid levels in the blood become too high, tiny crystals made of monosodium urate form and settle in the joint tissues. These sharp crystals most often appear in the big toe but can also affect other joints. The body sees these crystals as threats and reacts aggressively. Special immune cells in the joint, called macrophages and monocytes, rush to engulf the urate crystals through a process called phagocytosis. This triggers a chain reaction inside the cells, activating a molecular complex known as the NLRP3 inflammasome. Once activated, this complex causes the cells to produce and releases inflammatory molecules, especially interleukin-1 beta. This cytokine acts like a messenger, calling in more immune cells called leukocytes to the joint. As these white blood cells arrive, they release more chemicals that increase blood flow to the area. This causes the joint to become red and warm. The increased blood flow and immune activity lead to swelling as fluid leaks into the tissues. The combination of inflammation and the physical presence of sharp urate crystals irritates the nerve endings in the joint, causing the intense pain and that characteristic burning or fiery sensation. This inflammatory cascade explains why gout attacks happen suddenly and feel so painfully hot and tender. The immune system's response to the urate crystals is what produces the redness, warmth, swelling, and the fiery pain that makes gout so uncomfortable. Managing gout involves lowering uric acid levels to prevent crystal formation and using anti-inflammatory treatments to calm this immune reaction during flare-ups. Always consult a healthcare professional for personalized advice and effective management strategies.